Hello there, Dr. Sullivan here, Chronic Pain GP, back after a short winter break. Happy New Year to everyone, and today's short, brief video is about the most common rheumatological condition and chronic pain condition that I see in primary care, and that is osteoarthritis. You may notice the badge I'm wearing, and today's video is brought to you with the help and support of a charity and organisation called Versus Arthritis. One of the objectives of the charity is to improve the level of education amongst patients and amongst clinicians in the area of chronic pain and rheumatological conditions. Now, as a primary care doctor and chronic pain physician, I think it's absolutely imperative that patients have the most up-to-date knowledge with respect to their condition to help them to self-care and self-manage appropriately. Now, as mentioned previously, osteoarthritis is a very common condition. I see it in males, females, all different cultures, and people of all different sizes and ethnicity. I've seen it in young people, I've seen it in adolescents, and I've seen it in adults. So osteoarthritis could be defined as a degenerative rheumatological condition which can affect any joint in the body, but most commonly affects those joints which are weight-bearing, such as the hips, knees, and feet, and can also be seen frequently in those joints which are used most often, such as the lumbar spine and the joints of the hands and fingers. Now, the cause is thought to be due to a number of reasons, but primarily with the passage of time, the cartilage thins, and this causes a roughening of the edges of the bones. Now, this can cause reduced joint space and also slightly abnormal bone formation called osteophytes. This in turn can cause pain and inflammation. And often there's a spectrum of presentation in patients where it can be mild at one end of the spectrum and not cause any significant problems. On the other hand, I have seen patients who have really been quite unwell with it, and often there is bone-on-bone pain causing significant disability. I often get asked the question, how common is osteoarthritis? And I would say it's very common, and it is likely that we will all develop some form of osteoarthritis as we all get older. So the formation of osteoarthritis is correlated with age, but we see it most often in those patients above the age of 45. It is more common in females, and it's more common in those patients who may have fairly stressful manual jobs. Previous trauma to a joint can also predispose patients to osteoarthritis in the same joint. Genes are likely to play a role, however, research is ongoing for any possible link with genetic causes. Now, patients often present with pain and stiffness, usually worse at the start of the day. Swelling is often a common presentation, and this can be either a hard swelling or a soft boggy swelling. And sometimes patients describe noises coming from the joints, such as clicks or grinding sounds. Patients can experience certain limbs or joints giving way, although this is unusual. And sometimes patients describe worsening of symptoms with certain different atmospheric changes, such as a damp day. However, research is ongoing with this to see if there is any possible cause with the weather and osteoarthritis. A diagnosis of osteoarthritis can be done with a good history and examination, and clinicians may sometimes use blood tests to rule out other arthritic conditions, and an X-ray can sometimes be done, particularly of the weight-bearing joints, to look for reduced joint space and osteophyte formation. Now, the impact of osteoarthritis on patients can vary. It's often a slow process, and symptoms can wax and wane, and there doesn't seem to be any specific correlation between the amount of pain experienced by patients and changes on scans or X-rays. As with most chronic rheumatological conditions and pain conditions, it can impact significantly on the activities of daily living, such as simple tasks as walking, gripping. It can impact upon sleep, housework, childcare, and work. Now, before we talk about management, I put together a very brief summary about osteoarthritis. It's the most common type of arthritis in the UK. It is a disease affecting the bone and cartilage. There's a definition which we've discussed previously. It's usually a slow progressing condition which is often spread over years and usually affects those in their 40s and above. Millions are affected across the world, and in the UK it's thought to affect approximately 8 million people. So a common disease burden. And diagnosis is based on history and examination, blood tests, and occasionally X-rays. Now, research into the management and treatment of osteoarthritis is ongoing, and Versus Arthritis is one of those charities which is leading in the research to try and reduce the impact and burden of osteoarthritis on patients and society as a whole. Now, what I've done is looked at the current research behind management of osteoarthritis and split this into non-pharmacological management and drug-based management. So, non-pharmacological can include things like lifestyle changes, physical therapies, supplements. Now, there is limited research behind these supplements, but patients anecdotally do benefit from them. Complementary therapies, again, not often recommended by organisations such as NICE, but nevertheless, patients often do benefit from them. And right at the bottom there would be surgical management and replacement of joints. Pharmacologically speaking, there's a lot of research into medications which can help osteoarthritis, such as anti-inflammatories, whether oral or topical, capsaicin, which is chili cream as known by patients, and simple pain relief such as paracetamol and cocodamol. Again, I've talked about CBD oil in my previous videos and has shown some promise in chronic pain conditions. Steroid injections are often used by clinicians and musculoskeletal teams, and hyaluronic acid, not available on the NHS, but again, some patients do seem to benefit from this, but this can only be done privately. There's much more information on the Versus Arthritis website, and there's an excellent booklet on osteoarthritis, which can be downloaded or ordered from the website. There are support services available for patients who have osteoarthritis, including occupational therapists, and I often advise those patients who are in work to talk to their occupational health departments for perhaps adjustments at work, which can help them and support them whilst they're working. For those younger patients who are at school and college or university, I often advise them to get in contact with their mentor or tutor in order for adjustments to be put into place. So in conclusion, this is the most common rheumatological and pain condition that I see in primary care and in my pain clinics, and it is likely to affect us all at some point in our lives. There's lots of help and support and management options out there, including organisations such as Versus Arthritis. Now, well, thank you once again for listening. Please remember to subscribe, hit the like button, leave any feedback down below or any questions, and I'll try and answer them as soon as possible. And thank you once again for your time. And please remember, chronic GP is Versus Arthritis.